I think Sunil is just trying to join. I don't know why. Let me just
Yeah, Prashant,
share the link to him again. Yeah.
ask him to join through this WhatsApp group. GCCI WhatsApp group link. There is only
Yeah.
one link,
Yeah.
I
Yeah.
guess.
Exactly.
Yeah.
Yes. Yes. So Shanli, next time you should be careful when you send the calendar link. There will be two links sometimes, that will be created. Okay. Yeah.
Sure, sir.
Yeah. I think Sunil is joining now. Yeah.
Hmm. Good evening, everyone.
Yes, Sunil, go ahead, please.
Yeah,
You're
I'll
audible.
start.
Good evening. Good evening. Yeah.
Yeah. Good evening, everyone. Today, we are going to have a presentation from Dr. Pulkes on behalf of GCCI and Bioclues and Aabir Bio-services. We are going to have a talk by Pulkes on. Actually, my things are not working here. 1 minute. So, we are going to have a talk by Pulkes on changing the face of recurrent pregnancy loss and implantation failure, a new approach. I'm just going to introduce about Dr. Pulkes. So Dr. Pulkes is a reproductive genetist as well as a molecular anthropologist. He has obtained his postgraduate degree from Vidyasagar University in biological anthropology, and he has done his doctoral research in clinical molecular anthropology from Andhra University, Visakhapatnam, and he has done his postdoctoral fellowship from Punjab University on upshot of famine and epigenetics and metabolic diseases and fetal origin hypothesis. And he's an entrepreneur who is the founder director of Origin Life Healthcare Solutions and Research Center at Chandigarh, and co-founder and director from Institute of Nutrigenetics and Nutrigenomics. And he is looking after so many things like he has started some coursework also from genetic counseling, and he is looking after LS Foundation Education Health Institution, Janjir, Chandigarh, Chhattisgarh, and Bioscience Stem Cell Research and Therapy. And now he is heading the Department of Clinical Embryology and Reproductive Genetics, Rayat Bhara University, Punjab, and he is the professor and head of the department. So now we can have the talk from Dr. Pulkes.
Thank you, Dr. Sunil, for a big introduction. Good evening, everyone. After so many, actually, we have a discussion with Dr. Sunil and Dr. Niaz. We have a very good friend of last 3 4 years, and we are discussing about that so many things regarding the diagnosis, genetic counseling, and cancer diagnosis also. So first of all, I am a basically an anthropologist, and I have done so many research work in under the government of India.
Sunil, Sunil, can you mute yourself, please?
Uh, Pulakesh, we cannot hear you, please. Would you mind unmuting your microphone? Thank you.
Now I am audible.
Yes,
Yes,
sir.
very much. Yeah, please. Yeah.
And screen is showing, sir.
You can start, Pulkes.
Yes. Actually, screen everybody is Dr. Sunil.
Yes, yes. Go ahead, please. Yes, yes.
Okay. Thank you so much. Today we are discussing is to discuss about the understanding of endometrium, that is changing the phase of recurring pregnancy loss and implantation failure. Why we are saying that this is a changing phase actually. Before that, I just take some 2 to 3 minutes about our organization and all. Uh, our first initiative was the Origin Life in 2019. Then we started our second institute, that is Institute of Nutrigenetics and Nutrigenomics Research in 2022. And in that year, we also started our diagnostic services initiative, that is Own and Bride Lab and Diagnostic Services Private Limited. With this diagnostic and research initiative, we also started our venture with the university, that is with Rayadhara University. With the Rayadhara University, we have under the Origin Life, we established a new department, that is Department of Clinical Embryology, where we are offering the PhD, MSc, PG diploma, BSc, and certificate courses in clinical embryology. In the 23, we started another two departments under the umbrella of Rayadhara University as well as Department of Institute of Medicine. Okay. So here I am going to present under the Origin Life the who we are basically. Origin Life is the knowledge-based, novel, specialized infertility diagnostic laboratory and research center, or maybe this is the first specialized infertility diagnostic center in India. We are we have the solution for the infertility, miscarriage, recurrent pregnancy loss, spontaneous abortion, and IVF failure. Actually, we thought that soil profile and endometrial profile is the same. That means the mother womb and our mother earth both are equally they both are equal. How? Normally, a farmer when they are going for the crop and all, every time they maintain their soil through herbicide and others manicure or other thing for the proper plantation, a proper crop or successful crop production. In the similar way, endometrium also are the so many factors or nutrients which in, insist to grow the child in the endometrium or mother womb. That means there should be some infection free. There should be there should be some nutrition and others molecules which help the baby to grow and for the successful pregnancy and live birth. And last so many years, we seen that the implantation failure is a major problem in IVF specialist and patient because a single time there may be some problems. The first chance may that the baby will not implanted embryo is not implant in the endometrium because the embryologist is very good for making the embryo, that is we metaphor with the seed. They're making a good seed, but every time that embryo never become a baby. What is the problem behind that? Is there any problem with the soil or is there problem with the seed? Here the problem, seed means embryo or endometrium is the soil. So for this reason, we in about 5 6 years we are identifying different problems and we go through so many research. After that, after that we create some test also. I will discuss in later on. So, but during this implantation and all, this in human implantation, there is three stages. That means apposition, adhesion, and invasion. And these three stages take place a particular time of the menstrual cycle. That is day 20 to 24 of the menstrual cycle. And these three stages, for these three stages, there is so many molecules which helps for the whole cycle or implantation or successful pregnancy. That is related to adhesion molecules, cytokines, chemokinase, and others receptivity marker also. Well, near about in 2017 to 2023, we seen I visited so many cities of India, and I talked near about 100 and above infertility specialists. And what I seen that there is something lacking for this IVF success rate. The main their focus going to the quality of embryo. They are creating a good quality embryo or good quality embryo maintenance. They are not proper diagnosis the endometrial testing. They are doing some molecular marker for the endometrium, and there is a lack of awareness of patient management. So many IVF specialists. There is a lot of IVF center. The gynecologists, sorry to say that, the lot of the IVF specialists, they never know how to manage the patient. It is my personal observation, not in general. So don't mind everybody. And there is a no explanation about the unexplained infertility, REEF, IBFL, or RPL. And one is the most important thing that there is a lack of test of proper analysis of endometrium. The whole endometrial function analysis is not present now till date. In origin life, we are focusing the exactly unexplained infertility, the unexplained cause of infertility through complete endometrial diagnosis. Through the endometrium, if we diagnose we can diagnose the exact causes of unexplained infertility or pregnancy loss or IVF failure. Then we can answer the how to manage the patient, how to treat the patient. In original life, we thought that motherhood is not far if the diagnosis of infertility is correct and complete. So, we are introduced here in 2019 the one test that is called STEP, Soil Test Endometrium Profile. This test, only one test, can explain the unexplained infertility related to endometrium, and it can answer the proper endometrial receptivity function analysis. So already this test recognized by one of the most prestigious magazine, that is the Lifestyle Journalist. In their 21 issue, they already uh, cover as a pathbreaking for the unexplained infertility as a step test. And in the next issue, they also explain our origin life, what type of work we are doing for the unexplained infertility. So what is STEP? STEP or soil test endometrium profile is a combination of tests which can analyze proper function of endometrium. And STEP test is the most efficient way to directly assess endometrial function prior to the ART procedure to know the underlying causes of infertility, implantation failure, or IVF failure. So here we are analyzing near about 9 to 10 markers which are important for the implantation or pregnancy. That is related to endometrial maturation function, receptivity or adhesion molecules, chronic endometritis, that is the infection, pathogenic infection, or one of the most pathogenic infection is genital tuberculosis, maternal immune tolerance, and cytokine imbalance. So all the markers, that is endometrial maturation and function, that is cyclin E, which is the marker for the endometrial growth. P27, this is the marker for the maturation, the endometrium is proper mature or not. Integrin, it is the adhesion molecule. If integrin is present in the endometrium, there will be the chances of implantation. If it is not, there is a chances of implantation failure. If the mucin is present there, there is a chances of implantation failure also. If there is infection related to any causes, that is we diagnose through the plasma cells, and it is also a marker for the inflammatory. And the pathogenic infection, for the pathogenic infection, we diagnose the genital tuberculosis, that is particularly the latent tuberculosis, not active tuberculosis. And for the maternal immune tolerance, we are identifying the exact amount of uterine natural killer cell that is the different from the normal peripheral blood natural killer cell. So that is the important marker for the endometrial growth, maturation, and proper maintenance of the child in during their gestation time. And another two important marker, that is the cytokines. We know that the Th1 cytokine and Th2 cytokines, and another is Th17 cytokines. The pro-inflammatory cytokines, that is, if Th1 is present higher than the Th2, there is a chances of implantation failure or pregnancy loss or any other causes. If they are also present of Th17 cytokine, that is a pregnancy destroying marker. If that Th17 present, there is a chances of implantation failure, or there will not be a implantation, proper implantation. So for this step test can give a clear picture of the endometrium. That means we call the soil, the proper soil analysis. After that, we can go for the further management of the patient. Through this step test, we can identify the unexplained infertility, endometritis, infection, IVF failure, endometrial receptivity, potential and function, and maternal immune tolerance, and cytokine imbalance. So the main five factors for the implantation that can be diagnosed through this our endometrial testing. So why step test? The step test can define the influencing factor, that is unexplained infertility, recurring implantation failure, recurrent reproductive failure. Based on the step analysis, a personalized intervention can be designed that we call PPOT, personalized treatment protocol. We doing here with that report, we are creating the personalized treatment option. We are giving the treatment option to the doctor. According to that protocol, doctor can manage their patient also. And through this single test, that we can identify the proper endometrial role or endometrial condition. Till date, in all over the world, there is only five type of endometrial testing present. That is ERA. Lot of IVF specialists, they know about this ERA, and another test also came as a OPERA. That these two marker, that is a molecular diagnostic test, which can uh, give the particular time when we can transfer the embryo to the to the exactly this can be give the timing of the embryo transfer. It will not give the exact analysis of the endometrium. So this test need, if there is any changes, the timing changes, need for another test also. And it in intervention, only hormonal intervention will be there. And this test is available in India as well as it is basically from the US company. Another test also there, that is the ER map, ER grade. That is also the molecular dating test, which gives also the same the which day you can transfer. And only their intervention is the immune therapy. They need two biopsy, and this company from the Spain. Another test is that endometrial function test, and it gives only maturation of the endometrium. It is also from USA. Intervention as a hormonal intervention. And another test is receptive DX. This test can give the as answer as a inflammation or infection in the endometrium. That is also from the US. Only from whole Asia, we have a test that is step test. That means after last 3 4 months ago, we came to know that we are the fifth rank in the world. We are giving the almost all marker, all analysis, one a complete analysis of endometrium. In a soil test endometrium profile, we are giving almost everything, whatever necessary for the proper implantation or proper growth of the child. Here we can see that endometrial growth, endometrial maturation, endometrial receptivity, tolerance, cytokine imbalance, infection, and chronic endometritis. And we are from the India only. In our in-house study, near about 500 endometrial testing, we saw that there near about 64% patient have a growth-related problem. Only 8% patient have a maturation, endometrial maturation-related problem. 76% patient have receptivity-related problems. 88% patient have near about 88% have the immunology cytokine imbalance. Immunological problem 68%, chronic infection that is 84%, and genital tuberculosis, the latent genital tuberculosis 64%. This is our in-house study. Already we have submitted our paper to a reputed journal that is under review and all. Maybe within a few months it will come in published mode. This is our sample test report where we give the result with the picture, with the evidence of picture and their comments and important suggestion, which type of management can give to the patient. That's, for this test, endometrial biopsy is required. In a preferably we prefer the day 21 of in a cycle day of 21 biopsy. In a natural cycle, that is 7 to 9 days of after ovulation, and HRT cycle, that means hormonal replacement therapy cycle, we need a sample or progesterone day 6 to 8. For this collection, we have a specialized customized collection kit, which is not required any temperature control. We can keep this kit to the room temperature. There will be no hamper of the sample. This is a very important kit for us. We prepare for in-house only. And this technique, all the test, all this parameter is diagnosed by modified immunohistochemistry method, and all our test is done by uh, near about 5 scientists at a time. And we required only 10 days after receiving this sample in our laboratory. So, suppose we have a sample, we diagnose everything. What will be the next? That there is a we have a solution for that. We are not giving only the test report. With that, we are giving the suggestion. We are giving the solution for the patient also, solution uh, for understanding of the report to the doctor also. if there is a problem related to infection, first we suggest that you go for the infection rule out first. Second, you go for the immunological imbalance or through immune therapy, any form of immune therapy they can go. And third option, they can go for the main maturation and receptivity related problem. This is the main protocol in which this way, if we do the management, the patient, we manage the patient, there will be huge success of implantation. Already we have a data from 39% to 79%, we have increased our success rate in our in-house IVF center also. Here some intervention with the parameter which have already all doctors, all gynecologists, infertility specialists, they are already practicing all this medicine, but we need to change their chronological order. Which intervention will go first and which intervention go the next. So we are also giving with this treatment protocol also. This is our the personalized plan of treatment, which we call the PPOT. So here, generally, there is a three type of intervention we do. If there is infection, go for the ATT and all, and immune therapy. If there are ET related problem, if there is a hormonal related problem, they can go for progesterone, which they will give the details about this treatment option. And if there is a problem related to endometrial thickness, if there is a increase above 7 mm, but there is a failed IVF, but implantation failure, there may be chances of immunological problem in the endometrium. They need to change the local immunity. They need to change the uh, hormonal imbalance in the endometrium only. Through we can change this immunity through the two therapies, that is PBMC therapy, peripheral blood mononuclear cell therapy, and we can increase the endometrial thickness through the PRP therapy. There, we also give this personalized protocol for which day they can go for the PBMC therapy, in which day they can go for the PRP therapy, and all, and when they can go for the implantation, the ET transfer, which day they can go for the embryo transfer. With this diagnosis to patient management and patient management to therapeutics, the whole program we suggest to the IVF center. We track their patient history also, and we have a continue coordination with the doctors, so we can see that after diagnosis to live birth. We we have all the track record how we can manage the patient. In this way, last 2 years we are giving the whole services to the up to Delhi, Chandigarh, Punjab, Rajasthan, and West Bengal. We have so many centers, so collaborative center who are taking our these services, as well as we have a collaboration for the research and publication also. Our another tagline is regenerating fertility and happiness. In this year, there is so many publication already done by so many scientists all over the world. So what is the importance of many immune therapy, the lymphocyte immune therapy, how this immune therapy is giving the they are giving the beneficial for the successful pregnancy also. We are create a protocol for the which dose will be given to the patient uh, according to their medical condition. We have an in-house kit for lymphocyte immune therapy also. So already some research scholar they already published as a lymphocyte immune therapy for preserving pregnancy mechanism. We call it is a ray of hope for mother to be. So many patients we have seen after the this immune therapy, they have a live childbirth. After 7 to 8 time IVF failure patient, they get their live baby. So that's why we call it is a for mother to be. Already we know that what is a lymphocyte immune therapy. It is this For this therapy, we take a sample from the husband or the male partner, or we process in a laboratory, and after that, a particular lymphocyte we extracted from this whole uh, lymphocyte, and then again we inject to the mother body to create the paternal immune antibody to the mother, which help to decrease the Th1 or Th17 cytokine and increase Th2 TREG cell, which are favorable for the successful pregnancy or gestation. Already it is published by so many scholars all over the world, where the Th1 or the Th1 Th2 cytokine imbalance also there, and they already told that already mentioned that the immune system is important for the unexplained infertility, and lead therapy also give the successful pregnancy also. This is the grammatical diagram where how inflammation create the implantation failure. The what the important role of TNF alpha and their infection related to plasma cell and infection, and how they have a pregnancy loss. That this is already who are in this field, immunological field, they can understand this diagram. Here, just I say just presented here the Th1 cytokine if increase and Th17 cytokine, there will be chances of implantation failure. Here, if we using the paternal lymphocyte immune therapy, there will be the increase of Th2 cytokine TREG cell, and which give a successful pregnancy or live birth. Overall, that lead or lymphocyte immune therapy modulate mother immune system to protect the fetus and make the pregnancy prosperous. Immune therapy give before and during pregnancy is superior than only giving before or a single dose. There is a protocol. If we are using the lower dose for treatment, that will be give better result than the higher dose. It is our in-house observation what we are doing last 3 years. The PRP therapy already know so many persons. So what is PRP? Platelet-rich plasma therapy. It is using nowadays for the reproductive science or for rejuvenating ovary, uterine lining, and other male factors also. So many publications related to PRP therapy. This therapy also we are using here, and we are preparing our own PRP therapy kit also for the patient, not for the commercial. Only we are using for the in-house diagnosis and in-house research work. Platelet-rich plasma therapy or PRP is a autologous blood product consists of highly concentrated preparation of platelet and a small volume of plasma. Hundreds of bioactive molecules such as growth factor and other cytokines and cell adhesion molecules which store within the platelets and granules, which create a release of particular of a growth factor, which uh, regenerate, which act as a regenerative bioactive of the endometrium. In this PRP therapy, we seen that near about 6 mm to 10 mm increase of the endometrium. Some of the female there have a problem related to endometrium thickness. Through this PRP therapy, we increase their endometrium thickness 6 to 10 mm, up to 10 mm, only of 2 to 3 doses. Only 2 to 3 cycle we inject, we place the only PRP to the uterus, and we seen that there is a huge success of this implantation also, as well as the endometrial thickness also. The actually the what are the roles already all knows about that what type of work platelet is doing, that stimulation of the cell proliferation, differentiation. It is like act as a stem cell. What the stem cell is, they release some bioactive product which act as a proliferative or a differentiative agent. Like that, the latex is also releasing some kind of bioactive and which prepare the endometrium or regenerate the endometrium properly. Till that, PRP is using for various gynecological disorder, that is skill lesion, cervical ectopy, vulvar dystrophy, and PRP also using in aesthetic gynecology uses, and PRP also reproductive medicine. They are using for the premature ovarian failure, ovarian torsion, and other factors. Already you have seen in this screen. Another important immune therapy we called the peripheral blood mononuclear cells. This is a very important therapy. Nowadays, some of the IVF center using this therapy, and it is also popular in Japan. They are using this therapy regularly for the local immune of the endometrium, local immune changes of the endometrium. In this case, take the sample of the patient and they culture in for the some day, and again they flush to the uterus. In this way, to change their immunological factors of the uterine immunological factor, not the whole body immunology. There is some changes, whole body immunology and uterine immunology. So through this PBMC, we have a huge uh, changes of the endometrium immunity, as well as there is a changes also in the endometrial thickness. There are so many publications related to these peripheral blood mononuclear cells. Already it is published so many scholars, and they are doing a great job. They are doing a great research related to this field. Here we can see how this PBMC can change their immunity in and how they can increase the success of the implantation. PBMC can change. Already I discussed in previous. This is a diagrammatic presentation where the different of molecules and marker how they act for the trophoblast implantation. Peripheral blood mononuclear cells contain T and B lymphocyte and monocyte. These cells include the product of cytokines, interleukins, growth factor, which has been shown in some studies that exert a positive effect on the endometrial thickness and endometrial receptivity. All this work we have done with some institute, some IVF center, some scholars. We have some collaborators, research collaborators, that is Raidhara University, from where we are giving all our course and the new our academic curriculum. Another our collaborator is Indira IVF Group, Udaipur. From there, they have near about 110 IVF center, and they are sending their sample for this testing also. We have a collaboration with the Punjab University, Lovely Professional University, Guwahati University, Harisingh University, Madhya Pradesh, Institute of Reproduction and Childcare, Haryana, Matritva, that is in New Delhi, and Advanced Fertility Center, Punjab, and so many other center is there. But just I giving the main center from where we have a good research work with them. We have a center nowadays up to Central India, not in South India. We have the center from Punjab, we have the center from Haryana, Chandigarh, Delhi, West Bengal. All over near about from Central India to North India, we are getting the so many samples, so many diagnostic services and collaboration, and we are slicing to up to other state also. Thank you so much for all of your patience. Maybe I don't know how much you can get understand about this. Thank you so much, sir.
Thank you, Pulkes. It's very nice presentation. So, Raj and Niyaz, can you and the audience can have some questions?
please. If any person,
Yeah,
if any question, you can discuss here.
I can ask one question.
yeah, one, yeah, Sunil, please.
Uh, how about the pre-implantation genetics also? If your people are doing or not, pre-implantation genetics.
See, we are
Which,
not doing the pre-implant genetic testing. It is a defined part.
yeah, it
If
should be because IVF cases are and you are planning infertility cases, so you can go for pre-implantation genetics part also.
definitely, sir. If we are think that if there is a genetic part is normal, if genetic is normal, then this is the main causes. Whatever we are doing, genetic is dependent. Pre-implantation genetic testing, it's related to embryo quality. Embryo quality or embryo is good. If there is an embryo problem, there is chances of the implantation failure. If embryo is normal, then this is the main factors we need to check for the endometrium.
Okay, thank you.
Yeah, wonderful talk, Pulikesh. Thank you so much. It's something news to us. I was just wondering, post COVID, I mean, as the scenario changed with respect to the pregnancy loss and as well as the postpartum complications, if at all, in lieu of this endometriosis. Yeah.
Sir, we don't have this type of any data with us. No IVF center is giving this type of data to them, but they give some information. If any patient have a vaccination related to COVID, they are curing their some other infection. They have a positive effect for the other infection. They have infection related to HPV. That they have cured by the COVID vaccination. But we don't have this type of lot of data. Only because whatever data we get from the only the gynecology, whatever they are sharing with us. Actually, we don't have any direct contact with the patient. We are get all the sample through the doctors only.
Right. I understand. And on a general note, Pulakesh, I know you also exhibited a bit of dismay and a kind of a disappointment where doctors may not really handle such kind of pregnancy losses and some kind of patients suffering with this. There is also some kind of a mental trauma that these women undergo at the mental loss. Now, apart from genetic, counselor, or is there any kind of a psychologist who is really involved in treating such kind of women? And if at all, if scientists like you or geneticists like you and me, if this is suggested to the doctor, how is this built up? I mean, is there any kind of a gap that is going to be bridged between a clinician, a woman, and a scientist?
Exactly, sir. That's why I started the genetic counseling department. Basically, there is no such psychologist in the IVF center. Only doctor, whatever she knows, but he knows, she only counsels the patient. But that is not up to the mark. When I have a talk with so many doctors, they need a proper genetic counselor or psychologist to handle the proper counsel the patient. It is very gap. That is a gap. They need a proper trained person for the IVF center. I am going to suggest for our ERT team also that should be a this should be mandatory to have a psychologist and have a genetic counselor in the IVF center. Or that should be that then can be it is a good for the all the health system in India.
Yeah, thank you. I'll reserve one more question if there are no questions from others. Sorry, Nayas, please. Yeah.
Yes, thank you so much for your presentation, Pulakes, and accepting our invitation on this GCCI forum.
Thank
And
you, sir.
yeah. So I don't have any such question, but I just wanted your feedback, genuine feedback. How I mean, together we can bridge the gap. Uh, as far as there is a huge gap, you can say, between geneticist and clinician. How do you feel like where what is the roadmap according to you as per your experience? Because you are interacting with the clinician on day-to-day basis, and you know better their attitude and practice and where they are and what need to be done. How we are going to align with them? That is the question for today's session actually. Yeah.
Actually, I have a plan for that. If we can work together, we can create. Already, you have a good platform as a GCCI and others, your bioinformatics group. If we create a good skilled genetic counselor who have the proper certificate, not only certificate, no need of if they can counsel, they can analyze the proper report. Lot of genetic counselor is there, but they don't have any knowledge of how to analyze the genetic counseling report. So I think there is a gap. If we join together, we can create such kind of scientist in genetic counseling field. Maybe this will give the another breakthrough for our health or in this field.
So what I feel and what
What
I've
do you
experienced also, uh, because there is a limited exposure to genetic counselors as far as experimental biology is concerned. For example, they are interpreting the data that is coming out of the lab, and most of the genetic counselors they know theoretically, but they were never exposed to that technique like any sort of higher end technology that is used in nowadays diagnostic services like fluorescence in situ hybridization as next generation sequencing based technology, microarray based. To name few, I just giving an example. So, in your lab or in collaboration with institute or university that you recently step up with nutrigenomics also. So, I mean, can we design a module in such a way that they will gain some expertise at the laboratory level as well? Not only the course model design based upon the theoretical part. Like, I don't know. Like, I just wanted to know from your side what can be done for
actually
a better exposure to the genetic counselors in an upcoming, era. Actually, yeah.
exactly, sir? You are in right. Actually, we are establishing our laboratory as well as we have some collaboration for the next generation sequencing and others also. If any student come to us, we have a theoretical part. With that, we have a laboratory exposure to our collaborative laboratory. We are also have a in-house laboratory, but it is not now. It's not the up to the mark. We don't have that sequencer. We don't have a whole genome sequencer also. For that purpose, we have some collaborative partner, and also we are asking for the others collaborator laboratory also, who wish to join with us for the course curriculum. So
Yeah.
already
Thank you so
I
much.
have a one center from Bangalore.
Yeah. Thanks, Pulakes. Thank you so much. I think Dr. Dhanlakshmi is here with us, so she can share her experience as well as a senior genetic counselor. We are lucky to have her actually with us on GCCI forum as a co-chair.
Yeah, actually, apologies. I am in the laboratory, so I will not be able to talk. I've just put my earphones, and I am, like I'm in the wet lab area, unfortunately. But I'm very happy to listen to Pulakes and the good work that they're doing. Congratulations. I mean, I really did not know like such good research in the infertility area is happening. So, congratulations. And I wish Prakash or anyone else could take over, please. Yeah.
Thank you, ma'am.
Indrani is having some question.
Yeah, thank you, sir. Just one question. So I just wanted to know, because mostly in pregnancy loss, we commonly associate with some genetic factors or environmental factors, like all the things which affects the mental health or physical health of a woman. So is there any hereditary factors or also associated with this pregnancy loss, sir?
But, not exactly that study is not happening, but there is a linked with the hereditary problem. If their family history have a pregnancy loss related problem, that girl or that woman will face same type of problem. But it can be possible to recover from these problems through the proper management. See, all we are in epigenetic era. We can change. We can't change the DNA, but we can change some factors in our present day. Through this procedure, we can change that hereditary problem. We just manage, not we can change the hereditary problem, right?
Yes, sir. Yeah. Thank you, sir. Thank you, sir.
Also,
Yes, Simi has raised.
Yeah, I'm Dr. Simi. I'm working in a medical college. What I feel is that you need to have an interdisciplinary research platform for that. What's happening? Bioinformatics on one side, then the computational biology on the other side, then the gynecology people and the pediatricians, they are also entering the thing. But the people from biochemistry and pathology are not entering into the field of genetic screening. We need a comprehensive platform so that we can go further on it.
actually, ma'am, we are creating for that. We are trying for that to create a platform where we can join all the scientists, clinician, and others, all the fields. Actually, we have a platform for that. I have so many doctors, pathologists, biochemists also. They are associated with me, and we are trying to build a good platform. But GCCI also a very good platform. From here, we can start to join them. We can invite them to join a different model where we can work all the field in together. I hope that can be.
But I suggest one thing that it should involve various medical colleges. Going in the periphery, going the private practice will not serve the purpose, because the clinical material is in abundance in the medical colleges. So if
Yes,
it's a government medical college at number of places or a very big health universities, please try to involve them so that you can have a collaboration and you'll generate your own data.
right.
Thank you.
One more, Dr. Agu. If you can.
Thank you for the opportunity to talk. I am Peter. I'm connecting from Nigeria. Dr. Pulakes, I would like to know whether you talked about some of the underlying factors to be expression of cytokines, inflammatory cytokines, and some nutraceuticals has been linked to anti-inflammatory effects. Do you think that exploring nutrients or nutraceutical to mitigate these cases will be a promising aspect of the immunotherapy? Thank
Yes,
you.
yes, that can be. Thank you. Now some nutraceuticals product also coming for the changes of the immunological problem, which can give the proper nutrition of the endometrium. Thank you so much.
Yeah, Prash, can you give a vote of thanks here?
Yeah, I think maybe Nayaz it would be nice. Nayaz, would you mind? Yeah, otherwise I'll do that. Yeah. First of all, thank you so much, Pulakesh, for your wonderful talk. It was a kind of an awe-inspiring talk, very lucrative, very lucid, very informative, and something very important in the adage of the current endometriosis that women would really face in their prepartum or postpartum phase. One of the major things that you have also described is the need for bridging the gap, where there could be certain disagreements in an agreeable way between geneticists and clinicians, which we have founded this GCCI some 3 years ago, and this is where we are also trying to do this. And as Nayaz and Sunil have pointed out, we could also bring up a kind of a strong curriculum so that these kind of curriculum in the form of standard operating procedures could be taken up at the grassroots level, maybe at a very nascent level hospitals where maybe this can really be taken up, and with a word of mouth, like the conferences that we are trying to take up, this can really be achieved. That's where you have wonderfully spoken about in all those slides today. We are greatly honored by your wonderful learned experience that you have taken up today. With this, on behalf of uh, our President, Secretary and Treasurer, and also Joint Secretary in the form of Shalini Rajgopal, President Sunil, Secretary Nayaz, and the other Secretary in the form of um, uh, Dhanlakshmi. I thank you all. I thank for your gracious presence today. We would send you a token of appreciation, and we would welcome you as a honorary life member of Bioclues. Today. Thank you so much, friends.
Thank you so much.
Without any hesitation, I hope you will not. You will not have any second hesitation in putting on your camera for a wonderful photograph with Pulakesh. Okay, so that we'll give a big round of applause to him first. Big round of applause so that he can also hear.
Yes.
We cannot see Nayaz and Sunil, our main men behind this event. Yeah, you could see Sunil now. Yeah, I think we are only 9. Is it? I think I need to make. I mean, I'm taking a photograph from here. I don't know how to take it. Yeah, maybe I'll just join this. So Shalini, can you take a photograph? No. Oh, you can't take? Don't worry. I'm a good photographer. Give me a minute. Give me a minute. Yes. 1 minute. I'm just joining my desktop. 1 minute. Huh? I don't know why I'm not able to join. Shalini, you have to allow me, I think. 1 minute. Sorry. Yeah. I'm joining. Yes. So now I can see all of you, all 14 or 15 of you. Yes, very good. Yeah. Shalini, yeah, you are there. Nayas, would you mind switching on your camera? Namaskar, ma'am. Thank you so much for attending. I hope you are well in US. Dr. Kaab, yeah. Thank you so much. Yeah. Nayas, would you mind switching on your camera, please? Yeah. No, Nayas is not there, maybe. Yeah. 3, 2, and 1. Yes. Thank you so much. So we'll wait for the
Thank
next GCCI meeting. Yeah.
thank you.
Thank you,
Thank you so
Dr.
much.
Prash. I really appreciate
Thank
giving me the opportunity always to connect to
Thank,
Indians. I'm far, but
thank
I'm
you.
near.
thank you so much.
Thank
Thank
you.
you.
Thank you, Pulkes.
Thank you, sir. Thank you so much.